So, what's up everybody? I'm Dr. Matt. As always, I've got Dr. Adrian here with me. Welcome back to the RLND podcast. We're going to be truly real with you here. We had a different episode ready to go this week, but after some patient conversations and really just what's going on in healthcare in general, we both felt like this couldn't wait. This is urgent, honestly.
Yeah, because we are absolutely sick and tired of watching people just get chewed up and spit out by a system that keeps selling surgery as the normal next step for back pain. And it's not just the system, it's the frustration of watching patients buy into it because they don't know there's a better way. It's truly heartbreaking.
So, let's start with the definition. FBSS, failed back surgery syndrome, it's a real diagnosis, you guys. What it means is simple. Surgery didn't fix the problem. Sometimes, actually, it made it worse. In fact, it happens so often that the World Health Organization, in conjunction with the major insurance carriers, had to create a code for it.
And the numbers don't lie. Depending on the study, anywhere from 10 to 40% of spinal surgery patients end up with persistent pain, basically FBSS. One review reported around 15%. That's 1 in 7 people walking away from surgery still in chronic pain. I mean, think about that. 1 in 7.
And then, when you look long-term, it really, truly gets uglier. A study published in Science Direct found that over 8% had FBSS documented within a year. And then, the percentages, they just increase year after year beyond that. It's like a snowball effect.
And if you look at reoperations, so people needing another surgery, rates are 5 to 15% over 3 to 5 years, and up to 27% in workers' comp populations. That means up to 1 in 4 patients go back under the knife because the first surgery didn't do the trick. That's truly wild.
And surgery, it could cost upwards of $90,000 depending on the extent of the spinal surgery. So, here's the $90,000 question, right? If we know this, why do insurance companies keep paying for it? Seriously, what's going on?
Well, here's the truth, and I think people inherently know this. It's because the system is absolutely built to reward expensive interventions. Fusions, disc replacements, these are big-ticket items. Hospitals, surgeons, device manufacturers, everybody gets paid. Insurance companies still profit because they collect premiums and control payouts. Meanwhile, conservative care like chiropractic, dirt cheap by comparison, and often more effective long-term. The data doesn't lie there either, Dr. Matt.
Second reason, insurance is super short-sighted. Their box checking looks like this. Did the patient survive? Did the x-ray show the hardware in place? Did the patient report a little pain relief right after? Check, check, check. They call it a success. Never mind that 6 months later, that same patient is back in the office with FBSS. It's ridiculous.
Third, decades of inertia. The guidelines still say, after failed conservative care, surgery is the next step. But what counts as failed conservative care, Sometimes it's just 1 round of physical therapy. That's like saying, I went to the gym a few times, didn't get abs, guess I need surgery. It's completely illogical, right?
And don't forget patient demand. People in pain, they want a quick fix. If insurance denies surgery, they risk lawsuits and bad press. So, what do? Approve it, shift liability onto the surgeon, and walk away clean. It's, just how it works in this broken system.
Meanwhile, chiropractic, rehab, lifestyle change, they're undervalued, undercovered. They'll pay 90 grand for a fusion, but fight you on 20 visits to a chiropractor. That's insane, absolutely insane.
I had a patient in his 50s who had a lumbar fusion. The surgeon told him, you'll be back to work in 3 months. A year later, he's still out, still on pain meds, scar tissue everywhere. And now his insurance is telling him he's out of chiropractic visits because he used up his benefit. Tell me that system isn't broken. I mean, come on.
I had a woman who flat out said, I wish someone told me about chiropractic before my first surgery. She was on her second fusion when I met her. These, unfortunately, are very common occurrences that we see regularly, and we're just one office. More pain, less mobility, higher disability risk. Studies show up to 36% of fusion patients end up with complications and 11% with permanent disability. This isn't rare. It's truly predictable,
Imagine this, you guys. You're in pain. You've tried meds, you've done the rounds. Someone in a white coat says, this surgery will get you your life back. You trust them. You wake up from surgery. Months later, you're worse. You can't work. You can't play with your kids. You're dependent on opioids. That's not just a bad outcome. That's stolen hope.
And it's not just numbers, honestly. It's quality of life. FBSS patients report higher disability, worse mental health, and lower return-to-work rates. Some reports show only 26 to 36% manage to return to any kind of work. That's devastating for families, just truly devastating.
So here's the truth bomb. Up to 40% of spinal surgeries fail. Reoperation rates are 5 to 27%. And long-term success for lumbar fusion is only about 50 to 60%. That's a coin flip, folks. A coin flip.
Meanwhile, conservative care, chiropractic, exercise rehab, lifestyle change is safer, cheaper, and works with the body instead of against it. That should always come first. And you know what? There are actually studies that show conservative rehab is more effective than surgery. It just takes a bit more time, that's all.
So, if you're listening and you're being told surgery is your only option, stop. Ask yourself, have I really exhausted conservative care? Because once you cut, you can't go back, right? You just can't. It's a permanent thing.
And if you've already had surgery and you're dealing with FBSS, please don't give up. Conservative care can still help. It may not erase the past, but it can absolutely give you hope and function back, which is like truly powerful.
That's it for today's episode. If this hit you in the gut, like it. And please share it because your friends and family need to know this. It might just save someone from a lifetime of regret, honestly.
And as always, stay strong, stay skeptical, and stay realigned. You guys, thanks for listening.